Hi, my name's Emily. I'm going to be the nurse practitioner that's doing your mental status, cranial nerve, and musculoskeletal exam today. Can you tell me your full name and date of birth?
Zach Seach, December 23rd, 1993,
And can you tell me where we are?
at the doctor's office.
And can you tell me the day, month, and year?
It's Thursday of August in 2022.
Okay. At this time, I'll note that the patient is well groomed. He has appropriate posture and is keeping appropriate eye contact. Have you had any recent confusion, disorientation, anxiety, depression, or irritability?
No,
Okay, good. And what did you do today?
I worked for 12 hours.
And then came home? Okay. Can you tell me the similarities between a lemon and an orange?
The fruits,
Can you tell me the similarities between an ocean and a lake?
body of water,
And a trumpet and a flute?
instrument,
Good. Can you finish the sentence? An engine is to an airplane as an oar is to a.
boat,
Good. I'm going to have you start at 50 and subtract by 7 until you get to the number 8. Whenever you're ready.
50, 43, 36, 29, 22, 15, 8.
Very good. Okay, so I'm going to say a couple of things. And I'm just going to have you repeat after me. Ready? 8675309.
8675309.
Okay. Dog.
Dog,
Sunny day.
sunny day,
No ifs, ands, or buts.
no ifs, ands, or buts.
Can you spell the word world?
WORLD.
And can you spell that word backwards?
DLROW.
Okay, I'm gonna have you do a couple commands. Can you close your eyes? Open them back up. Close your eyes. Keep them closed. Open your mouth. Okay. Relax. Close your eyes. Open your mouth and raise your hand. Good. Can you read this sentence?
Close your eyes.
Okay. Can you tell me what this is?
Pencil.
This?
Watch.
Okay. I'm gonna have you write a sentence of your choice. I love my dog. Very good. Okay, so now we're going to start with our cranial nerve assessment. First, we're going to start with the olfactory. So I'm going to have you close your eyes, and can you occlude one of your nostrils with your finger? Okay, can you tell me what this scent is?
Garlic.
Okay, and we'll do the same on the opposite side.
Garlic.
Good. Now we're going to assess the optic nerve. So I'm going to have the patient cover his right eye, and I will start behind him. And can you tell me when you can see my fingers?
Now. Now. Now.
Okay, and then tell me how many fingers I'm holding up.
1, 2, 1, 4, 3.
Okay, switch. Tell me when you can see my fingers.
Now. Now. Now.
Okay, tell me how many I'm holding up.
2, 4, 3, 3, 5.
Okay, so you need to get your eyes checked. Um, so now we're gonna do the ocular motor, which is cranial nerve 3. Your trochlear, your trigeminal, and your abducens. These are all included in the exams we're going to do, including your corneal reflex, which is just your trigeminal cranial nerves. So first, I'm going to have you look straight ahead at an object and just check. Go ahead and fixate straight ahead, and we'll check his light reaction in each pupil. And each pupil is equal, round, and reactive. So now I'm going to check for accommodation. I'm going to have you follow my finger to your nose. Very good. Go ahead and close your eyes. Very good. Okay, tell me when you can feel this cotton ball.
Now. 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 Now.
Okay, good. And then we're going to do the same with a safety pin.
No. 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 No.
Alrighty. We're going to test the visual eye fields, the 6 visual eye fields. So go ahead and just follow my finger. Okay, and I'll note that there's no nystagmus, double vision, or blurred vision during that test. Lastly, we're going to do our corneal reflex, so go ahead and just stare straight ahead at me. Okay, so next we'll move on to our facial cranial nerve. Go ahead and wrinkle your forehead. Yep. Flex your eyebrows. And I'm going to have you smile. Make a kissy face. Make a funny face. And then extend your neck out on both sides equally. Good. We're going to move on to the vestibular trochlear. With this, we're going to do our Rhines test and our Weber's test. First, we'll start with the Rhines test. Go ahead and tell me when you can hear it the loudest. Ready?
The first spot.
Okay.
The first spot.
Okay. And then Weber test. Tell me if it's equal in both ears.
Yes.
Okay, good. Okay, so now we're going to do the glossopharyngeal assess and the vagus nerve. So I'm going to have the patient stick his tongue out and say ah. Open real wide. I'll note that the uvula is midline and there's equal symmetrical movement on each side. We're going to test the accessory cranial nerve. Go ahead and shrug your shoulders. Okay. And then lastly is the hypoglossal. Stick your tongue out and move it side to side. Very good. Okay, so we're going to test our upper extremities. I'm going to have you bend your elbows up and don't let me push them down. Good. I'm going to have you bend your arms at your side and don't let me push your hands out. Good. Go ahead and put your hands flat out and don't let me push them down. Good. I'm going to have you touch your nose and then touch my finger. Ready? Okay. And take your thumb and move from your pointer finger to your pinkies. Okay, good. You can stop. I'm going to test your rapid alternating movement. So I'm going to have you place your hands on my palms and flip them back and forth. Okay. Very good. We're going to test the lower limbs. I'm going to have him dangle his feet loosely. We're going to start. I'm just going to relax your leg and we'll let it fall to gravity. Good. Good. Alrighty, so we're going to assess the patient's gait. I'm just going to have him stand in the corner here. Walk normally to the point of the camera. Okay, and then turn back. Walk on your tiptoes. Turn back and walk on your heels. Okay, and then walk back to me 1 foot in front of the other. And then go ahead and turn. Put your feet together. Close your eyes. And we'll note that his balance is good. Okay, you can sit back down. Thank you. Okay. We're going to test sensation starting at the toes to the ankles and up to the knee. Tell me if you feel normal sensation and equal on both sides, okay? Sensation all the way up?
Yeah.
Okay, good. And then we'll do, go ahead and stick your hand out this side. And just tell me if there's equal vibration on all your fingers. Equal?
Yes. Yes.
Good, and we'll just do your big toe.
Mm-hmm.
Now we're going to check your deep tendon reflexes. We're going to start with the brachial. I'm sorry, the bicep. Just relax. Good. We're going to move to the brachioradialis. We're going to do the tricep. Good. To the knee. Good. And then the ankle. Good. All right, and then we'll do the same thing on the opposite side. So bicep. Brachioradialis. Tricep. Knee. And behind the ankle. Good. Well, those deep tendon reflexes are good. Then I'm gonna test for ankle collinus. So all I'm gonna do is force dorsiflexion of the foot and note any pain.
No. No.
Okay. We're gonna check for a Babinski sign. So I'm gonna have the patient lay flat on his back. You can flip to the head of the bed if you want. Okay. So I'm gonna start at the heel, and I'm gonna work around the outer surface of the foot to the toe. And there's plantar flexion and more plantar flexion. So those are positive Babinski signs. Can you go ahead and lift your neck up? I'm going to note there's no involuntary movement of the knees or hips. So that's a Brzezinski sign. And then we're going to do, you can relax your neck, Koenig sign. So I'm going to have him lay flat again, bend the knee. I'm going to straighten the leg. Is there any pain?
No.
Okay. Same thing over here. Any pain?
No.
All right. Very good. Now we'll move on to your musculoskeletal exam. So if you could sit again on the side of the bed for me. We're going to start the musculoskeletal exam with assessing the fingers and the wrists. So I'm just going to palpate down each of the fingers, noting any nodules or masses. I'm also going to note that there's no swelling, redness, no abnormal coloring. Both of the wrists are symmetrical. And the contour is normal, and joints are aligned. I'm going to assess the radial and ulnar heads. Okay, we'll do the same on the opposite hand. Down each finger, no nodules or masses. And the radial or ulnar heads, no tenderness.
No.
Okay. We're going to do range of motion for the wrists and hands. So first we're going to have you put your hands flat, raise them to the ceiling, put them down to the floor. And have you spread your fingers and then put them back together. So that's normal flexion, extension, adduction, and abduction of the fingers. We're going to do the same thing for the wrists. So I'm going to have you put your whole hands up. Put your hands down. In. And out. Normal flexion, extension, and adduction of the wrists. I'm going to check the anatomical snuff. So I'm going to have the patient put his hand sideways. Put your thumb straight up. And I'm going to palpate in the notch. Is there any pain?
No.
Okay. Same on this side. Any pain?
No.
Good. So now we're going to do our carpal tunnel exams. First, I'm going to have the patient push his palms to the ceiling. I'm going to hyperextend the wrist. And I'm going to palpate. Any pain?
No.
No pain? Okay, now we'll do our prayer position. So push your wrists together to see if there's any pain.
No.
No? And then lastly, we're going to do the medial compression test. So make a fist with your thumb inside and then flex downwards. No pain?
No.
Okay, so no signs of carpal tunnel there. Next, we're going to check an Allen's test. So I'm going to occlude each of the arteries in the wrists. I'm going to note that, can you flatten your hand? I'm going to note that the hand turns white I'm going to release each of the arteries separately and no color change. So there's pink to the hand. I'm going to include them both again and then release the other, and it returns to pink as well. And we'll do the opposite side. Good. Good, and he has a positive Allen sign. Next, we're going to assess the elbows. So I'm going to palpate the allochron process and note that there's no nodules or masses. And I'm also going to palpate the medial and lateral epicondyles on both sides of the elbow. And there's no nodules there. Do the opposite. Any tenderness?
No.
No. Also, I'm going to note the elbows are symmetrical. There's no swelling, redness, deformities. The contour is normal and they are aligned. We're going to do range of motion for the elbows. I'm just going to have you push them out. Go ahead and flex. And then we're going to do pronation and supination. Good. Next, we'll assess the shoulders. So I'm going to start at the suprasternal notch, and I'm going to work my way out to the shoulder. Here I'm going to note the AC joint, and then I'm also going to note the coracoid process on either side of the bicep, the lesser and the greater, and they are both present. We'll do the same on the opposite shoulder. Okay, no swelling or tenderness there. And then we will note the biceptual groove as well. Good. So we'll do range of motion of the shoulders. So I'm going to have you go forward and then reach back behind you. Good. And then out and in towards you. Good. All are normal. We're going to do our speeds test. So make a fist with your palm up in the air. And then I'm going to push them down. Don't let me push them down. Good. Nearest test. I'm going to place my hand on the patient's scapula and have him lift his shoulder. Go ahead and lift your shoulder for me. Good. Good. And then I will check for the apprehensive test. So I'll have the patient get in like he's throwing a baseball and try to throw it. Good. And we'll do the opposite. Good. We're going to do our drop arm sign. So I'm going to lift the patient's arm. Go ahead and relax. I'm going to just slowly let the arm drop. Good. We're going to assess the neck. I'm going to have you put your chin to your chest, chin to the ceiling, turn to the right, and turn to the left. I'm going to have you put your ear to your shoulder, opposite side, and then go ahead and do a circular rotation of the neck. Very good. Again, I'm going to note that the neck is symmetrical on both sides. There's no redness or swelling. Everything is midline and centered. No abnormal colorings or skin folds. Okay, so now we're going to assess the patient's spine. I'm going to have him stand up. Go ahead and turn your back to the camera. Okay, so I'm going to note a nice S curvature of the spine. I'm going to palpate down each of the vertebrae to note any displacement or tenderness of the vertebrae. Any pain?
No.
Okay, and it's well aligned, and then I'll start at the top and assess the muscles on either side of the spine for any masses or tenderness. And everything is good. Okay, now we're gonna have the patient bend at his hips, touch your toes. At this time, I'm gonna note the spine is nicely aligned, the scapula are aligned. Can you put your hands on your hips, please? And I'll note that the hips are also nicely aligned. Okay, you can stand. Okay, and then just go ahead and twist both sides and bend to both sides. Okay, good. Now you can sit back down. Actually, I'm going to have you lay flat on your back. Okay. Go ahead and lift your leg. Good. And the opposite. Good. I'm gonna lift your knee. Go ahead and relax your knee. Good. Okay. Go ahead and flip to your belly. Can you scoot over a little bit so that you can see it good? Okay. Go ahead and lift both your legs one at a time. Good. Good. While the patient's on his belly, I'm going to note the ischial tuberosity, and I'm also going to note the iliac notches. Okay. Now I'm going to have you turn to your side. Go ahead and lift your leg sideways and just kind of across your body as best you can. Very good. Now you can relax. While the patient's on his side, I'm going to note the greater trochanter. And I'm also going to note the celiac notch. Okay. Now go ahead and turn to the other side. Lift your leg up and across your body as best you can. Good. Relax. I'm going to note the greater trochanter and the celiac notch. Okay. You can lay on your back. Go ahead and I'm going to lift your leg and tell me if there's any pain.
No.
No?
No.
Okay, very good. Okay, so that's all for the hips. Then we're going to assess the knees. So I'm going to have you sit back up. Go ahead and dangle your feet. So I'm going to palpate the femoral and the tibial heads on both knees. I'm going to assess the patella. And I'm also going to palpate the back of the knee. Again, the femoral head, tibial head, patella, and back of the knee. I'm going to note that the knees are symmetrical. There's no swelling, abnormal coloration. They're aligned. So they look good for inspection. I'm going to associate the lateral and medial grooves. Good. Okay, go ahead and flex your knees. One at a time, flex up. Good. Go ahead and flex up. Good. And then I'm going to have you turn in and out. In and out. Good. Lastly, we're going to assess the ankles. I'm going to note that the ankles are not swollen or red. There's no abnormal discoloration. They're nicely aligned. I'm going to palpate the heel. I'm also going to palpate the top of the foot. Any tenderness?
No.
Okay. I'm going to have the patient flex his toes up, flex them down, turn your feet in, turn your feet out. All right, awesome. And then can you just make a circle with your feet? Okay, everything looks good on the ankles. Any questions?
No.
That's going to complete our exam today. Thank you.